Hello guys, I keep reading your comments in which there was an asking of individual. He asked whether hydrocele, varicocele or a cyst can reduce our sperm count or not. So basically today I will tell you the difference between all three and how these three affects your sperm through this video. So first of all, we will talk about the hydrocele. Hydrocele occurs when fluid filled in the scrotum, causing it to swell. This fluid accumulation often leads to inflammation of the scrotal walls, making the scrotum appear red or even swell. The swelling and the discoloration are common signs of hydrocele. And if there is an infection or an injury, then the fluid starts secreting and this fluid fills in your scrotum and makes your walls so big. That cause inflammation in scrotum which results in hydrocele. Remember, hydrocele can cause infertility. It means that hydrocele also has the power to reduce your sperm count. So now comes to the second point, which we call the epidermal cyst. Now when a lump forms on an epidermal layer, because of these testes do not have any way to deliver nutrition. So they have an epidermal layer that holds the testes. So if a lump form on this epidermal layer, then it is called the epidermal cyst. And the cyst has a 50% chance of impacting the sperm. This means it does not have a direct impact on your sperm. It only has a 50% chance of lowering your sperm count, which can cause infertility somehow. So now comes to the varicocele. So suppose supply of the blood in the veins and the arteries near the testes is blocked and does not function as it does. This is one of the reason for the varicocele problem, and that blood flows properly through the arteries to the testes, but the veins are unable to carry the deoxygenated blood away efficiently. This results in deoxygenated blood being sent back to the testes, causing potential complications and disruptions in normal functioning. Because of that conflict, the testes do not understand what to do and they reduce their functionality and a bit, which gives you pain and causes infertility too. So basically you have a chance of getting infertility in hydrocele and varicocele, but there is a chance of 50% of getting infertility in cyst, which I should say can cause problem in producing sperm. And if you think that varicocele is not a treatable, but it is not a right, you can treat varicocele. Yes, I'm not joking here. Just see the before after reports of my patients. They are now living varicocele free lives. Additionally, there are no complications if you have a cyst, because cysts are curable and get cured quickly. As compared to varicocele and hydrocele, there is no issue with the cyst. Talking about hydrocele, the biggest problem in a hydrocele is fluid retention. Fluid is coming and filled up, so the fluid has to be removed by injectables or whatever means you have prefer, even by surgery, because medicines does not work properly in the cases of hydrocele, and medicines only works in a mild hydrocele. But when your hydrocele has reached a severe case or has reached to a severe grade, then looking at that problem, there is only one option, which is normal surgery. So basically all three have the power to make you infertile, but the treatment of all three is actually available. For the varicocele, cyst and the hydrocele, there are very good results in treatment options like Ayurveda, homeopathy, and you can opt for any one of these. Either way, both ways are very reasonable and amazing. They also work well in side by side hydrocele. When it is in mild grade and at a very low grade, it increase, then both of them cannot work properly. So today I am also telling this thought this video that if there are all three problems, then a cure is available, whether it's in Ayurveda or a homeopathy. But which method should be used for that, this is up to you. And for that, you will definitely have to consult with your doctor. So that is for today video. If you want to know anything or have any such query, then you can share your reports at the number given below. You can talk to my team and get the right solution for it.